Hello and welcome back to my channel, Dr. Magnesium, with me, Dr. Lee Keegan. And today we're going to be doing the final part of the UPF series, which is the damage caused by eating a diet high in UPFs or by eating UPFs in general. So the body is affected by UPFs in many different ways, and I think the first and most obvious or the most visible way would be obesity. So as we've mentioned in previous videos, obesity can be caused as a direct result of eating UPFs through increasing calorie intake directly, because UPFs tend to stimulate reward centers within the brain, make you feel good about yourself, make you feel it's pleasurable to eat, which makes you want to eat more. This all kind of taps back into our primal instincts to eat a diet which is high in sugars in order to get us immediate release of energy so that we can escape predators or we can fight for our territory or whatever that may be. UPFs tend to be calorie dense, so they're thick, they have high amount of calories within a small amount of food space. This tends to cause a quick transit through the gut, as we've mentioned previously. As it's going through quickly, they also tend to be high in sugars, so the body will metabolize the sugars quickly, use the sugars for quick energy. As it's doing this, because it's traveling through so fast, the body thinks we need to hold on to the fats. They also tend to be high in fats, so we use the immediate sugar source, energy source, and we store the fats in specially designed cells called within the adipose tissue, which is the fat, basically the blocks of fat. Leading on from that, we would have a metabolic syndrome, which is often as a direct result of obesity. Metabolic syndrome leads to, or encompasses, I should say, type 2 diabetes, high cholesterol, high blood pressure. This is a problem, obviously. Type 2 diabetes is a topic on its own. Of course, there's many different conditions, such as chronic kidney disease, can cause poor vision or visual loss, peripheral neuropathy because of damage to the small blood vessels of the nerves. Also, more recently, we've discovered that it causes microvascular angina, which is chronic heart pains, and dementia. So the small blood vessels, vascular dementia, the small blood vessels of the brain are damaged, which causes a lack of blood, a lack of oxygen to get to the brain, and an overall damage to the brain itself. Leading on from metabolic syndrome, we have the autoimmune diseases. Again, kind of links in. It causes inflammatory, UPFs cause an inflammatory process, the pro-inflammatory, which causes direct inflammation of the bowel. This can lead over time to chronic changes within the gut flora, so you get chronic diarrhea, chronic loose stools, but you can also get damage to the layers of the bowel itself, which causes inflammatory bowel disease. Leading on from this, you can get cancers, so you can get directly bowel cancers from what we've just said, but also liver cancer is directly linked to a diet high in UPFs. That's thought to be because you get direct storage of fats within the liver, which causes inflammation of the liver, hepatitis, which basically just means inflammation of the liver. After a certain amount of time, the inflamed, swollen cells start to die off, and you get a cirrhosis picture. Cirrhosis will then eventually lead on to hepatocellular carcinoma, which basically means cells of the liver cancer. This is common with alcoholics as well, who get a cirrhosis, but more common now, believe it or not, in obese patients than in alcoholics. We're getting these more problems with the liver coming in from non-alcoholics than we are from alcoholics. Leading on from that directly, we have cardiovascular diseases. Again, there's a pro-inflammatory involvement. There's also the high cholesterol from the metabolic syndrome causes atherosclerosis, or plaques, calcified plaques forming within the blood vessels of the heart. These cause a narrowing of the blood vessels to the heart, cause angina. Over time, the blood pressure builds up behind these plaques and causes ruptures. This causes clot formations and a blockage of blood getting to the muscle of the heart, which is a heart attack. Similarly, you can get cerebrovascular disease. in the same kind of formation. We've just mentioned cerebrovascular disease previously, with the blood vessels being damaged to the brain causing dementias, but you can get strokes as well. From a similar picture of what we've just described with cardiovascular disease, you get plaques forming, you get blood pressure building up behind the plaques, causing a rupture of a plaque, you get a clot, and then you get a blockage of a blood supply to parts of the brain and death of that part of the brain, which is basically a stroke. Also, the final part I would say would be the mental health side of eating UPFs, the mental health implications. So there's obviously the reward, as we've just said, the sugar spikes, which cause a high, a feeling of elation, a feeling of pleasure, which are quickly followed by a low. If this cycle is repeated continually throughout the day or over weeks or months or years, you're getting continual highs, continual feeling good, feeling pleasure, followed by that deep crash and depression and feeling of low after you've used up the initial available sugars within the blood. Also, that leads on to depression. But as we've stated earlier on as well, when we were talking about diabetes, a direct reason or something that's been linked recently to UPFs is dementias, following the pathway that we've just mentioned with the either cerebrovascular disease or whether it's a more complex pathway leading to Alzheimer's. But I'd say that's enough information. I don't want to go too deep into everything, but I hope that's give you an overview of the health problems caused by eating a diet high in UPFs. We can go into this a little bit further in a little bit more detail in future videos. If there's any interest, if people want to know more, let me know and I'll go into specifics, like maybe cardiovascular disease, we can go into that more specifically, or inflammatory bowel disease, whatever you want to talk about, I'm open to ideas. So thank you for watching this video. Again, if you like these videos, please subscribe to my channel, share away, get the message out there, and